brought in with critical trauma with a chief complaint of altered.
Okay.
Yeah, I have this patient. We found him in the
we-
street. He's 50 years old, male.
Okay.
Hit by, don't know, either bike or car. Yeah. So we found him. He's lying in the street.
You found him in the street. Any
Yes.
other information? Any other?
No.
Sir, can
no.
you hear me?
Sir. Hello,
Can we
sir.
start
So
with
he was
you?
not responding. His initial GCS was 3.
GCS is 3.
Yeah.
Can we check his airway, please? Is he breathing?
The patient has blood at his nares in the corner of his mouth.
Suction.
He has sonorous respirations.
Okay.
Okay.
And circulation, can we check his pulse, please? Pulses?
Airway first. Let's
Yeah,
get airway
airway.
dealt with. So let's suction. Let's get intubation supplies.
Yes.
Yeah.
Let's get ready for intubation.
Okay, doctor, suction is ready. Okay, what? I'm doing suction now.
Can we?
Does the suction sound? Or is
Okay.
the patient?
Yes.
So we're sectioning.
All right, suction. Is the patient breathing on their own after suction?
The patient has sonorous respirations.
Let's establish an airway. Let's do rapid sequence intubation. Let's get
Let's
IV
try
access.
adult thrust first. Let's see if all we need is just a little bit of support there and all we need is an OPA until we can get intubation done.
Okay. Can we get the IV
Jaw
monitor,
thrust
the
is
monitor
performed.
as well?
Sorry?
Can we get the monitor?
Can we see
his
it?
vitals?
Yeah, okay. I will attach the patient to the monitor.
Thank you.
Okay.
On visual inspection, there is no masses obstructing the airway.
Okay. Are they breathing okay with jaw thrust? Or are they still
Yeah,
sonorous?
and they're
Patient
starting on
with
IV.
sonorous respirations.
Can we get IV access?
Take the airway.
Sure, IV access started.
Thank
Let's
you.
do it. All right, so
So 10 of etomidate.
10 of etomidate, please.
Okay, so you want me to give Etomidate 10?
Yes.
Okay, sure. Etomidate 10, IV started.
And Rob.
And rocuronium.
Yeah, let's rock around.
okay, while you're doing
Okay,
that,
how much
check
rocuronium do you want,
pulses.
Doc?
How much?
I don't remember.
So we're checking pulses.
70?
Whatever the
Pulses are
pharmacist said.
thready.
Ready pulses.
Okay, but are they present, femoral and radial pulses present?
Pulses are thready.
Okay, so we're checking for the rocuronium dose, but etomidate and rock.
Do we know how much this patient weighs?
Yeah, he's 70 kilos. I have 80 ready.
Okay, so can we do?
Yes, okay. 80 milligram of Etomidate, rocuronium given.
Okay.
All right.
And now we will lift his chin and visualize the ports to intubate.
Use a 7.5 ET tube. Test the balloon.
Test the balloon, and then
Intubate.
intubate, yeah.
Inflate the balloon,
Inflate.
check end tidal CO2,
Check breath
and
sounds.
breath sounds, and stomach sounds.
10 milligrams of etomidate are pushed. 80 milligrams of rocuronium are pushed. Cords are visualized. 7.5 ET tube is passed the cords. Balloon is inflated with 10 cc's. Appears firm. On breath sounds, you hear
Nothing.
absent breath sounds on the left.
On the
Okay,
left.
so deflate the balloon, pull out just a little bit, and then reinflate the balloon. And try again.
Balloon is deflated. It is retracted. Balloon is reinflated with 10 cc's of air. You hear decreased breath sounds on the left.
Okay. Let's try needle decompression.
Without any visualization.
Yeah. So did we do breath sounds before we did the intubation? And what were those?
You just
breath
had
sounds?
sonorous.
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 Not respirations.
Can we just throw a linear probe on that left side?
Ultrasound is obtained.
Do we see?
Yeah,
Is he
okay.
lung floating
Do we
on
see
that left?
barcode?
Where
or
is
lung floating?
ultrasound? Okay,
The ultrasound is up.
here is the ultrasound.
Okay. Let's do a needle decompression on the left side, at the midclavicular line.
Okay.
We're gonna go at the second or third intercostal space. What do you guys think? Second or third?
I think second is.
Second. Let's go second intercostal space. We're gonna do a needle decompression. We're also gonna prep for a chest tube, and we're gonna try the needle decompression first. See if that works.
Okay.
So, sanitize the skin. Needles in.
You hear a gush of air with your needle decompression.
Okay.
Chest tube is set up at the left of the patient.
Okay.
Please describe the procedure.
So for chest tube insertion, we'll go mid-axillary to the fourth
Forward.
intercostal
Yeah,
space.
yeah.
We'll clean it, make an incision,
Above the rib.
above the rib. push through the pleural space with
Can we
the
type in cross for
Kelly.
blood, please?
The curve.
Okay, I will send tab across for the blood.
We'll spread the curved Achilles and make sure that we have a finger into the pleural space.
Sweep the lung.
Mm-hmm.
Um,
And then we'll clamp the end of the chest tube with the curved Achilles and follow the chest tube and the curved Achilles along our finger.
and then push the chest tube anteriorly. And then
We'll secure it with an
Secure it
occlusive
up.
dressing and hook it up to a pleurovac.
Chest tube has been secured.
Okay.
No blood is evacuated.
We're gonna check his pupils. Are they reactive?
Right pupil, 4 millimeters, minimally reactive. Left pupil, 3 millimeters, minimally reactive.
Okay, let's
so it is the same on the sides.
Yeah, me too.
4 and 3 minimally reactive, both sides. So we got a guy who was found down in the street, GCS of 3. He's tachy. See his blood pressure starting to become hypotensive, and had a tension pneumothorax that we just treated. So we have an airway, we have breathing, circulation. He has 30 pulses.
Let's finish our fast exam to close out that circulation loop. Make sure
Okay.
we don't have massive hemorrhage.
Great, let's do a fast.
Yeah.
So we're gonna do E-fast.
Okay, I have here the fast.
Ultrasound
Exam.
is being obtained.
Perfect.
Okay.
So while we're doing that, we also type in cross for blood.
Your cardiac view is up.
Does that look like fluid to you guys?
No,
No.
It doesn't
mine
look
looks
like
on.
fluid to me. Looks like liver
Right
sitting
below?
against the heart. Well, that's above, right? That you're looking
At
at?
the top, yeah. At the top of the heart.
Yeah.
I think it's.
So this is coming in contact with the skin. This is the top right. There's a fat pad on top, and I'm saying below. You see the margin of the heart, and then there's underneath it another margin. So is there
You don't
fluid?
think that's liver up at the top of the screen?
Yeah, I'm not talking about the top of the screen. I'm talking underneath.
He's talking about down here.
Yeah.
Yeah.
I know.
Is that fluid?
I don't think so.
Okay, then let's move on.
No.
That's fine. Morrison's touch is okay. Next. That's okay. Same thing. Next.
Okay.
Ladder's okay. And then splenomegaly. Did we get that?
Yeah.
Yeah.
That,
we
it
already
was, it was the second.
Oh, okay. Okay. So EFAS is negative after we've done
Except for, can
except
we-
for that,
the
right?
other one, yeah.
which we already treated. Okay.
Okay. So we don't have massive hemorrhage enough for an EFAS to be positive. Let's make sure we expose, we palpate down, we see if any of the other major body compartments have any signs of bleeding. You want to check the femurs.
Good.
Make sure there's no instability there, like a femur fracture is bleeding out into that.
Check the pelvis.
We want to check the pelvis, rock the pelvis. We want to roll him and check the back, make sure he's not bleeding into the bed and we're not seeing it.
Do
Your
we see
patient
any-
is exposed. There is bruising to the left chest with ecchymosis and crepitus. Chest tube is in place. Draining, no fluid. Pelvis is stable. There are multiple abrasions to both the anterior and posterior aspect of your patient, primarily over the chest and the knees. There is no bony deformity. The compartments appear soft.
Any obvious trauma to the head?
There are abrasions to the patient's face. No obvious deformity.
Okay. Okay.
Okay, let's make sure we have a seat collar.
Yeah.
Seat collar has been placed. There is no midline cervical spine step off.
And can we get 2 large bore IVs on the patient?
I already placed the
We got it,
IV.
yeah. Should
And
we-
glucose, and the point of care glucose the last time.
Yeah, that's good.
Yeah.
Point of care.
Did we
Here,
know?
glucose.
Okay.
Point of
Yeah,
care
the
glucose is 117.
Okay, so A, B, C, D, G.
Oh,
Yeah, we covered everything.
So we got our ABC,
A, B, C,
C, D, Z.
E, F, and G.
And we got
Yes.
our IVO2 monitor.
Mhm.
We know there's unequal pupils. We know there's a pneumothorax on the left, now hopefully treated with the big rush of air from the needle decompression, chest
Yep.
tube in place.
That's CT.
We need CT for everything, just like head to toe
Do we
CT.
want to get a chest x-ray?
Yeah, we'll need the chest X-ray.
First.
Was he intubated? He was, right?
Yeah, let's do the
Yeah,
chest
so
X-ray
we have
and
the
then
chest
go
X-ray.
CT
We have
head.
the chest tube,
CT
we
head.
have the
Yeah.
ET tube, we
We
need
never
an
got the chest x-ray.
Let's do that.
Can we get bedside chest x-ray, please?
Okay, so chest X-ray will be done now.
Should we consider giving him some fluids?
I think they're already running.
Oh, we already have it running?
Do we have a fluid
This is the x-ray you got prior